Hello everyone, today's video is about biofilms. There are a few different questions that were submitted about biofilms on some of my other videos, so I figured I'd just do a little amalgamation biofilm Q&A video. Just before jumping into the video, if you could please take a quick moment to please like, share, subscribe, and or post a quick comment on the video. I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. So the first question is, I'll just read it off here. So this was posted on one of my other videos, which was entitled, "Why Do Some Biofilm Disruptors Not Work?" So the question here says, presumably SIBO-related psoriasis here, so since the person is dealing with SIBO-related psoriasis, what about NAC, also known as N-acetylcysteine? I get lots of fatigue for about a day after taking even 500 milligrams, which is generally about one capsule, increases proportionally with the dose, 1,000 milligrams or more, and I can't go out for the next day for anything. There's a product called Phase 2 Advanced, which has a combination of bismuth and alpha-lipoic acid, which creates a dithiol complex, which is a good Phase 2 biofilm disruptor. So a person saying that this particular product used to cause the same symptom, but now it doesn't give fatigue, and then mentions that monolaurin, which is another supplement entirely, causes psoriasis to get worse. So thank you for the question. So again, can't give any direct advice, but just to speak of things a little bit academically. So I've mentioned in some other videos, as I've had lots of biofilm related videos, it's a topic of interest, not just to me, but apparently folks out there in the interwebs as well. So NAC, I have heard it classified as a phase 2 biofilm disruptor. I've also heard it classified as a phase 1 biofilm disruptor. Clinically, as I've mentioned in other videos, I don't really see it having a strong phase 2 biofilm disrupting effect. And the reason I believe that's the case is because I've had patients who have, like this individual, by the sounds of it, had some notable either benefits or reactions, like side effect issues, not to say it's a side effect in the truest sense, but when a person went on a phase 2 biofilm, when a patient of mine goes on a phase 2 biofilm disruptor and feels worse, then it indicates to me that we're likely breaking down those biofilms and releasing more microbes out into the open than the patient's body can comfortably deal with. So then we pull back on the dose till they tolerate it, and then gradually build it up, and they eventually tolerate it well in most cases, and we go from there until the biofilms seem to have been dealt with. So when a patient is having a clinical response to a biofilm disruptor in that type of way, then that's a clinical indication to me that we're affecting some change here, that the biofilm disruptor is doing something. It's really rare that I see that happening with NAC, which is why I suspect that it's not a very strong biofilm disruptor. Now, as is mentioned in the question here, this person was getting the same reaction with a phase 2 biofilm disruptor as they were from the NAC. So that is some compelling information to suggest that maybe the NAC is working on breaking down biofilms in an analogous way to a stronger phase 2 biofilm disruptor like a bismuth alpha-lipoic acid dithiol complex. I guess at the end of the day, the evidence at hand is like, yeah, it could be that the NAC is working as a strong phase 2 biofilm disruptor in this particular case. So that's certainly one conclusion that could be drawn. Another possibility is that it might be a coincidence because where fatigue is the driving issue here, it could be that like fatigue is not a very specific side effect to have from a supplement or from a detox process or a biofilm disrupting process. So it could just be a big fat coincidence in that, like, well, NAC sometimes causes fatigue because it's upregulating glutathione production in the body, and then that glutathione is causing more detoxification to happen than maybe the body's ready for, and so that could cause symptoms. So that would be another possible explanation as well. I think another possibility is that alpha-lipoic acid is a sulfur-containing compound, and NAC is also a sulfur-containing compound, so it may be a link there where in the phase 2 biofilm, I think it's called phase 2 biofilm advanced, where that has the alpha-lipoic acid in it, and NAC also, and the product in question has alpha-lipoic acid in it, which contains sulfur, and NAC contain sulfur, so it might potentially be a link there where there's either just excessive sulfation reaction happening from both of those, or sometimes folks have sulfur sensitivities, or more appropriately termed sulfite sensitivities, so there could be another explanation there. So I guess that my official thoughts on this particular question are that could have been a coincidence, could be that it is indeed acting as a strong phase 2 biofilm disruptor, or that maybe there's a sulfur component there. So those would be a couple of possible explanations. Thank you for posting the question. Interesting question, and yeah, fun to kind of mentally work through that. So thanks for giving me a fun thing to work through on a Friday afternoon. The next question is posted on a different video. This one was posted on Are treatments for chronic Lyme and biofilms different? And so the question is, would herbs on the Buhner protocol also act as biofilm disruptors? So the Buhner protocol is in reference to the protocol from the late great Stephen Buhner, this wonderful herbalist, and there are certain herbs like Japanese knotweed and cryptolepis and alcornia and Sita acuta and Chinese skullcap and some others that were really popularized by Stephen Buhner and sometimes referred to as the Buhner protocol. So to my understanding, the herbs on the Buhner protocol are not known to have notable biofilm disrupting properties. Some of the herbs in there, like cryptolepis and Chinese skullcap, maybe Japanese knotweed, I'd have to double check on that, have been shown in petri dish studies to kill Lyme, at least, and I believe Bartonella as well, that's contained within biofilms, which is pretty cool. So does it break down the biofilms? I've not seen any evidence to say that it does or it doesn't. On paper, I don't know how it really would work in that way, but we have some petri dish evidence that it kills off microbes inside of those biofilms. So that's arguably just as good, maybe better, maybe not quite as good, but it's complementary anyways to a biofilm disruptor. So thank you for that question. And the last one is in reference to another video about biofilms. By golly, so many biofilm videos. This one was entitled Biofilms, Best Disruptors and How Long They Take to Work. And so in this, I must have referenced something about taking 2 to 6 months to get rid of biofilms, which sounds like something I would say, because that's something I've said to patients many times. So it says the 2 to 6 months getting rid of the biofilm. This is assuming how often do you administer the biofilm disruptor, daily, weekly, or monthly. So for my patients, what I typically recommend for oral biofilm disruption, at least, is that they start out by taking a dose every few days, just to build up, make sure they're tolerating it well. Then they'll start taking it every couple of days, and then if that's going fine, then they'll start taking it every single day. There are different regimens that are out there. It really depends on the biofilm disruptor in question, how strong it is, how well the patient's tolerating it. But generally, I build patients up to taking it every day at a certain dosage, and that's where that 2 to 6 month number comes from. So thank you for the questions. I hope that this was useful for folks who asked the questions and for other folks who happen to be listening or watching this video. If you have any questions about biofilms, well, I'll post a video about it, because apparently I've posted many videos about biofilms, but if you have a question about other health-related topics, please feel free to post that in the comment section below as well, and I will do my best to answer as soon as I can.